Hey everybody, and welcome back to Mountain High, an exploration into the opioid crisis in West Virginia. I'm Rachel, and together we will be diving deeper into why this is happening, the challenges the crisis presents, and what we can all do to help solve these problems. Joining me throughout the series will be Frankie Tack, West Virginia University Clinical Assistant Professor of Counseling, the Mayor and Chief of Police of Hurricane, West Virginia, Scott Edwards and Mike Mullins, Beaver, Executive Director at Ray of Hope in Charleston, West Virginia, Theresa, a family nurse practitioner and professor of nursing at West Virginia Wesleyan College, and a unique perspective from a person in recovery, Heather. Let's get started. In today's episode, we'll be hearing about challenges providers of care face within this epidemic. Theresa and Frankie Tack will give us more insight on compassion fatigue. Compassion fatigue is a phenomenon that affects all types of medical providers and professionals, but especially those who work in emergency departments and see patients with substance abuse problems. Let's hear from Theresa for more on this.
Sure. I am a family nurse practitioner, and I currently see patients, my own patients, in a clinic at Buchanan Medical Care here in Buchanan, West Virginia. And I also am a full-time assistant professor of nursing at West Virginia Wesleyan College, where I teach in the graduate nursing program. So I'm teaching the new nurse practitioners that are coming up and taking care of our population. I'm also a doctoral student at West Virginia University, and I'm getting my doctorate of nursing practice degree. I will finish up in May of 2019 with that. And my capstone project for my DNP degree actually has something to do with what you're working on, compassion fatigue. So I'm targeting that from the angle of teaching empathy. There's such a stigma with addiction. And in order to decrease that stigma, I think that we need to just teach compassion and empathy. So my proposal is to do a pilot study in a local emergency department. Actually, it will be completed at Davis Memorial Center, where I will do a 1-hour talk on empathy, and I will do some pre-measurements and post-measurements with this pilot study of how we measure empathy with a questionnaire. So I'll do the questionnaire before I do the talk, and then I'll repeat the questionnaire afterwards. I'll also have a control group with the questionnaire, and just to see if we can change empathy. It's kind of like the Cleveland Clinic commercial. If you remember seeing that, we see a photographer that just went through the Cleveland hospital, and he photographed people, and there were little bubbles that just showed what they were thinking through the day. And it was what they used to teach empathy at the Cleveland Clinic. And it was so successful that they actually made it into a commercial. And I do believe that empathy can be taught. And I think if we teach empathy and we reteach empathy, we offer this year after year, then we can actually change patients' experiences for the better.
Now let's hear from Theresa and Frankie for more details on compassion fatigue.
Sure. So compassion fatigue is not isolated to emergency departments or to healthcare providers or staff, and it's not even just directed at substance users or people that are afflicted with addiction. It can be in vets that take care of animals. It can be seen anywhere. So compassion fatigue is something that we need to address daily. And some people don't even realize that they have compassion fatigue, or that they maybe are in denial that they have compassion fatigue. But basically, people get desensitized or numbed to seeing suffering over and over. And what we see with that is certain healthcare providers are disproportionately affected, like those in the emergency department or those in obstetrics or psychiatric areas. And things like staffing issues, long hours, intense situations, these add to the sense of being overwhelmed. So that's why they are disproportionately affected with being desensitized or having compassion fatigue. Those affected by compassion fatigue often feel burdened by the suffering of others. They sometimes blame others for their suffering, and they experience physical and mental fatigue. And this is often met with denial, and there's data to show that patient care suffers because of it.
what's concerning about non-addiction professionals who are encountering people with opioid addiction so frequently now is they didn't sign up for that to be their main job. They didn't go to school and say, hey, I want to be an addiction professional. This is something I'm interested in, and they didn't receive the training and all the underpinning, knowledge about drugs and alcohol and how they can affect people and, that it's not a moral failing and understanding the disease process and the neurobiology of addiction, and so here they are. They thought they were going to be a nurse or a doctor or, whatever. And what they're doing most of their day is dealing with people with addictions in some of these settings. And I think they're feeling really frustrated because they really, they wanted to do other types of work. And I think also sometimes there's a sense of still this, this moral model that, most of the lay public have, that this is your fault, and so here you are using up the resources, and I don't really have compassion for you because you did it to yourself, kind of thing. And so I think that's one side of it. Another side, however, I think is just the hopelessness that can come when you're trying repeatedly to help someone get better, or you're trying to help a community get better, and you don't see it working. In medicine especially, this idea that, something's broken, as it were, in quotes, we fix it, you give your medication, we do some surgery, we, put a cast on it, et cetera. We fix it, hopefully. Or we help you maintain some healthy functioning ongoing. And I think, addiction can be very frustrating to treat because it's a high relapsing disease, and again, a lot of people don't have training in it. And I think that leads to burnout. I mean, I've heard of medical professionals leaving the profession right now because they just don't want to deal with it as their, everyday process.
As a nursing assistant, I've experienced the results of compassion fatigue firsthand. But now let's hear a little bit more from Theresa about what patients may experience as a result of compassion fatigue.
Well, as a professor, I have seen compassion fatigue. I have, my students are nursing students, and they're just getting an advanced practice degree to become family nurse practitioners. I've actually heard students say that work in the emergency department, if you overdose once, fine, I'll treat you. If you overdose twice, I'm going to treat you with a warning. And if you overdose 3 times, you deserve to die. And wow. I can't even fathom that, this is a human. This is a human being with a real problem. And this, to me, is some kind of psychological warfare that we think that if we treat this person really badly or if we teach them a lesson, then we're going to fix their problem. But that's not how addiction works. So that I think that this is a little bit inbred into the emergency departments or into these facilities, and patients, they experience jaded providers and they experience jaded nurses and ancillary staff, and we need to break that cycle because that's something that gets repeated and taught. So we need to start to teach compassion and teach empathy, and that's part of my pilot study, my project. I kind of want to do a theme of take a walk in my shoes. And I want to share patient interviews and stories about things that they've dealt with, everything from maybe food insecurities or housing insecurities or safety issues, all the way to how have you been treated by providers or healthcare professionals in the past. And I think that if I can show this to the staff and the providers and the healthcare professionals and make them think about what they're doing, because psychological warfare doesn't really change addiction. It just it actually makes it worse in many cases. So if you think of Maslow's hierarchy of needs, you need to meet patients' needs. You need to meet their safety, their food, their housing, their love, and their nurturing. And then they can achieve higher level functions, which would include maybe battling their addiction. But to just treat a patient poorly isn't really going to help them in their course of becoming clean. I think we all have the same end goal, but what we need to do is teach compassion to get there.
When we talk about the opioid epidemic, we often forget to think about how this impacts the providers we count on for delivering healthcare services and solutions. People who work in emergency departments or clinics, or even EMTs, are a critical part of finding a solution. Like they say in an airplane, put your own oxygen mask on first. These providers have to have the skills and tools that they need in order to deliver high-quality treatment. In the next episode, we'll talk a little bit more about treatment options. I'm Rachel. Thanks for listening to Mountain High. See you next time. Thank you to Frankie Tack, Theresa, Scott Edwards, Mike Mullins, Marie Beaver, and Heather Darr. I'm Rachel. Thanks for listening to Mountain High. See you next time.